Welcome, everyone. My name's DJ Wells. I'm the Executive Director of the Mensah Research Institute, and you've joined us for, again, our weekly webinar broadcast where we're talking about those things that are starting to concern us and keeping us concerned as it relates to the COVID-19 pandemic. I'm seeing plenty of people signing in right now. We're so glad that you're joining us. Today, we've got a special treat for you. Joining Dr. Mensah, who is with us every week, is Dr. Judy Bowman, the co-founder of Mensah Medical. And we tried something a little bit different this week. We sent out a little bit of notice that Dr. Mensah and Dr. Bowman were going to be spending the bulk of their time for this webinar answering questions. And we got a whole bunch of those questions in before we even started the webinar. So we've got a great group of questions already in place. But if you have more questions, if you've got something else that comes to mind as you hear Dr. Mensah and Dr. Bowman begin to share about this COVID-19 pandemic, we encourage you to send those questions in today as well. Use the Q&A function that's at the bottom of your screen there. Just click on Q&A, type in your question, and I will feed those questions to Dr. Mensah and Dr. Bowman as we get through the broadcast. We're scheduled to go today for about 60 minutes, but with all the questions that we have, we may go a little bit longer. So don't hesitate to send your questions in. We'll try to get to as many of them as we can over the course of the day. And so since we have so much to talk about today, I'm not going to belabor this anymore. I'm going to go ahead and start with those questions. Welcome, Dr. Mensah. Welcome, Dr. Bowman. We're so glad you're with us here today. And let me start by asking you, I guess, just a basic question, which is, someone wrote in and said, we've seen this called coronavirus, we've seen it called COVID-19, seen it called SARS-CoV-2. What are the differences between these names? It seems like coronavirus or some kind of coronavirus has been around for a long time. Is this a mutation of something that's been here before, or is this something brand new?
All right, well, that one has been quite a few pieces in that one question. So let's talk about the initial piece here. First of all, coronavirus really references a family of viruses. So the first SARS virus is a member of the coronavirus family. This particular creature is also a member of the coronavirus family. So it's the larger volume of different viruses that we call coronaviruses as a family. This is actually the coronavirus SARS-2. That is the actual name for this particular virus, and it causes the disorder or disease we call COVID-19. Okay, so that's really how it works there. Coronavirus is a family of viruses. The coronavirus SARS-2 is actually the particular element that causes what everyone has been panicking about, and that's called the COVID-19 disease or disorder. Okay. Mr. Wells, what was the second part of that?
Is this a mutation or a hybrid of the coronavirus family that you just discussed that's been around in the past then? I would assume the answer is yes, based on what you just said.
Yes, a lot of things are possible. Word is not still 100% definitive because even as we speak, more than a month ago, we found out that there had been at least 30 different mutations for this particular creature to date. And even more recently, there's still been conversation around new mutations that have been happening. So mutation capacity is certainly there. We know that there are elements of what we call the protein coat or the surrounding structure of the virus that has elements of the HSV and the SARS virus, the first one, that are present. So we call the protein coat, it's got elements of a few different viruses present. So more than likely, yes, we know that there are several mutations that have happened, and this is not just a stagnant virus.
Now, I've had a couple of people ask, about defining virus in general. One person asked, that there's been word that this was something that was manufactured in a lab. You know, and we hear all of these conspiracy theories about where it was created and is it alive, or is it something that we can kill or not kill? So often when people say you've got a virus, you just have to let it run its course. What are the intricacies around that? Is this something that could have been manufactured? And if it was manufactured, is it really alive, or is this something that we still don't know how to wrestle with?
Okay, well, first of all, we can't get into this whole concept of manufactured or not or whatever have you. I mean, science is all over the place and who knows who's doing what. The most important thing is that we have to focus on really what this virus is doing. We have to focus on who's affected by it and how to treat it, how to stop it, how to be able to do battle against this thing. Those are really the key pieces here. Where it came from ultimately is almost not even a functional question anymore, because it's here. And we can always talk about where it came from, but that doesn't do us any good in the here and now. So right now, scientists are trying to get a grip on how to handle and treat this condition. Viruses are not alive, not in the sense that you and I are alive. They're kind of almost like mindless little robots whose sole function is to replicate. So their job is to get into your cell structure, switch the DNA, mRNA around such that now the new orders for your cell are to produce everything this virus needs to survive. And then when all that is there, it destroys your cells and releases tons of new viruses. So I know most of you guys out there have seen the movie Alien or Aliens or Predator versus Alien. I know I have. I love that series. But the thing is here, what did the alien do, right? There was some type of creature that stuck under your face and then threw some glop down your throat. And then before you knew it, it started to develop a new alien creature inside of you. And then when it erupted, the new alien creature was free, but you were dead. And that's how viruses work at the cellular level. They infect the host cell. They cause this replication and development of proteins and so forth to create new versions of itself. And then it gets released by killing the cell that you got. So they're not alive, unlike the alien creature, okay? But what they are basically particles of DNA or RNA that seek to replicate themselves. They're just like little tiny robots, if you will, okay? But they're really nasty creatures in this sense because of the severity of the disease that they cause or produce.
So getting back to something that you said earlier in that answer, and that is what we really need to focus on is how do we stop this? How do we slow it down? How do we cure it? And one of our viewers asked, there's so many things that we're hearing from the CDC: social distancing, washing our hands often, wiping down surfaces, not touching our faces, wearing masks. Is there anything else that we should be doing above and beyond those CDC recommendations? We also had, and let me throw this other side question in, because someone just sent a question and saying, I'm starting to question the CDC because there's so much difference that we're hearing from different doctors, from the president, from all these different sources. Who can we trust?
Well, first of all, what we're really hearing are variations on a theme as we start to learn more and more and more, okay? And I'm actually going to comment on your president for a change. All politics aside, last week the president came out and said something very interesting in terms of what he was doing. And he's taking a certain pharmaceutical agent, that's one thing. But the other thing he's taking is zinc, okay? We're going to talk a little bit later about zinc and the importance. It's a hugely important thing. Those of you who heard us talk about this before know that I'm a big proponent of zinc in general, especially in mental health. But zinc is extremely important in physical health as well. Now, the CDC is working very well and it's got a pretty good grasp of some things to get things moving for folks. A lot of doctors are seeing new aspects to the manifestations of this virus and what it's doing. Very recently, the skin eruptions that kind of look at what we call Kawasaki's disease in children, everything from ARDS and respiratory failure to strokes to coagulation disorders and blood clots all over the place. It's become sort of a spiraling thing, but what's been happening is the virus revealing itself. It's revealing itself in many different systems. The heart of the matter is this. Every time we see a new manifestation, we in medicine have to adjust and we start to reconsider what the major pieces are for identification and therefore treatment. So it's not that people are wrong or there are the different versions. Many scientists, many doctors are seeing different aspects of this creature in manifestation. And then we're talking about treatment. Now, what's key is if you put a lot of these together, you've actually got the right story. And we're going to talk about that a little bit later as well.
So I've got a few questions here related specifically to masks. And that's certainly something that's been in the news quite a bit, with some of our leaders not wearing masks. We've seen some of the stories of people going out into public as states are starting to relax some of their guidelines for social distancing, and some are and some are not wearing masks. We're hearing some people say you don't need the mask. We're hearing some people say if you're wearing the mask, you're really only protecting others from catching it if you have it. What's correct here? All of these questions are getting at the same thing, which is we don't really understand the role of the mask.
Okay. Well, first of all, I want us to understand and look at something from a certain perspective. From a physician's perspective, this is really about life or death. This is about everyone in the population, not just me, not just you. There are, of course, people who are more susceptible to this creature than others are, and we all understand that. But really what you're doing when you're wearing a mask is you don't have 100% protection in either direction. But we're assuming that if you keep a far enough away distance and you're wearing a mask, you can decrease the amount of respiratory droplets, as we call it, the invisible spray of fluid, of spittle, of everything that comes out of your mouth, including viruses and germs. You can reduce that by wearing a mask, okay? And also, you can help prevent some of that from penetrating to you if you've got good enough distance. So the masks are, shall we say, supporting the idea of prevention and protection. If you're not wearing a mask, what happens is that you become, of course, very open. Respiratory droplets can sit in the air sometimes for several hours, believe it or not, okay? So you can walk by where someone else has been and never even seen them and come across a respiratory droplet or the virus and take it into your system, and then the domino effect begins. Let's not forget, if you're outside, there's wind. How many of you have seen a leaf blow for blocks or for huge distances in the wind? Certainly a viral particle can do the same, and then you come into contact with it. When I talked about this being about everyone, please understand, those of you who are not as susceptible, it can sit around in your system and you can pass it around to somebody else who is. And that person may be a loved one of yours. That's the real hard part. And I know our youth have been doing a lot of things and going to parties and so forth. Folks, it may not be you that get sick, but it might be somebody you care a lot about. And we've seen every age category come down with this disorder and pass away. Call it a disease. I'm sorry, not disorder, disease. This disease causes much disorder. But masks are very important. I think they should be utilized. And even if someone I'm not going to say, but in the administration per se or anywhere else is not wearing a mask, the odds are they're doing a whole lot of things to try to protect themselves outside of the use of that mask. And even our illustrious president talked about what it is that he's doing. Okay, so we have to be very, very careful about what we do because this is about everybody. It's not just about us as individuals, okay? And many of us don't realize the kind of susceptibilities we may have ourselves. So certainly I think that's a very key part of this whole protective process, and many doctors have said the same thing. This is not just me, okay? So washing your hands, all those wonderful things. As far as washing your hands is concerned, by the way, that is probably one of the singular most important things you can do. Because when you're touching things at the grocery store, opening the doors, even your own house, you don't realize what you are infected with. And most people have a habit of rubbing their eyes or their nose or whatever it is they're doing. They're touching themselves, and they're really just transmitting from place to place to place viral particles, bacteria, all sorts of things. So hand washing, everyone has said it already. I'm not going to bombard you with that. Extremely important.
So one of the other questions that I've gotten from several folks, actually, I think you just answered there, Dr. Mensah, and so I want to ask Dr. Bowman to kind of chime in here on this one in particular. You know, you said that, you know, obviously we're thinking about other people above and beyond ourselves, but how worried should a relatively healthy person be regarding this COVID-19 pandemic?
Some of my comments about that, it's not just about you. It's not about being selfish. Even if you are a very healthy person, you don't want to transmit to anybody else. And to also make comments about what Dr. Mensah was saying, there is such a thing called a viral load, something that we learned a long time ago in medical school. If you can control the amount of virus that is spread, perhaps maybe a particle or two gets into somebody's system, but maybe their immune system can handle that little piece. But if it's a large viral load, a lot of it, a big dose, their immune system might really be just simply overwhelmed. And that person, if they have any kind of immune compromise, may go down very quickly.
So speaking of immunity, Dr. Mensah, you've mentioned several times a number of things in many of our past webinars. And so, you know, certainly Dr. Bowman or Dr. Mensah, you know, please address this. Several Mensah Medical patients talk about the fact that, and Dr. Mensah, you just mentioned this last week, that several Mensah Medical patients talk about the fact that they often don't get sick because they're on a nutrient therapy treatment. And you've made some recommendations. So we've had several Mensah Medical patients send in questions saying, are the nutrients that I'm taking for my nutrient therapy protocol for my mental health and my cognitive health disorders, is that enough? Or do I need to be taking a little bit more zinc or a little bit more vitamin C or a little bit more vitamin D? And a couple of folks were specifically asking about vitamin D because there is the possibility of too much vitamin D.
Well, that last part can be in question now. Some PhD researchers have talked about using 50,000 international units of vitamin D for a variety of reasons, and no difficulties there. First of all, let me say, to all the Mensah Medical patients that are out there, for people we've consulted with and you're on a nutrient program, good for you. One of the fabulous side effects of treating these cognitive dysregulations, as I like to call them, other people call them mental health, is that you get tremendous crossover benefit for physical capacity and health. Most of our patients don't even remember the last time they were sick with a virus or cold or flu or anything like that. So you're already in a good place because our protocols are full of antioxidants. They're full of direct elements to help deal with inflammation and oxidative stress. And those are all pieces of what the COVID is busy doing and creating difficulty with. Now, as far as updates, so I've talked to a few people, and we've talked before about this, about some things we want to do a little bit extra for the next 3 months at least. So our recommendation is that whatever your level of vitamin C is, if you are an adult, by adult, I mean anyone over the age really of 12 to 15, is to have at least 6,000 milligrams of vitamin C, at least 6,000. Now, mind you, vitamin C can kind of move through your GI tract and can cause some level of, shall we say, displeasure with regard to diarrhea. But you can titrate up to that dose. That's what we're recommending for our patients as far as vitamin C is concerned. We also indicate that zinc, in the form of zinc picolinate, goes up to 100 milligrams for the typical adult, okay? Also, we did talk about vitamin D. We talk about 10,000 international units of vitamin D. So bring your programs up to that, again, for the next 3 months. Now, something we've not talked about, the addition of melatonin. And I'm going to tell you right now, melatonin is one of the most critical things that you could take for this COVID piece right here, right now. And the recommended dosage for adults who do not have COVID, who are not in the hospital, is 0.5 milligrams to 1 milligram. So half a milligram to 1 milligram at night, not during the daytime, okay? So quick summary for adults, we're talking 6 grams of vitamin C, 100 milligrams of zinc picolinate, vitamin D, 10,000 international units, melatonin, 0.5 milligrams to 1 milligram. So your vitamin C level is once again 6,000 milligrams. And you can do that divided in 2 dosages. So 3,000 in the morning, 3,000 in the evening, okay? So that's the quickie summary. All you people out there, keep taking your supplements. Good job. I hear very little about you folks getting sick. I will tell you though, I have heard from a couple of people who said they felt they may have had COVID or they were tested for positive for COVID. And they said that the worst they felt was fatigue for about 3 days. Severe fatigue, and that was it. They had no respiratory symptoms. They had nothing else going on. No big deal, doing extremely well. That's what was reported to me, okay? So keep up your good work, folks.
I need to kind of qualify some of the things. I agree with what you're saying. There are some people that cannot, I think, take lots of vitamin C. Depends on who you are and your circumstances. Those people with hemosiderosis, hemochromatosis need to be careful about that one. And there's some folks that are very sensitive to vitamin Ds. You would probably notice if there was any problem going on with any of those things. But in general, for those that are generally healthy, that would be the advisement in terms of what Dr. Mensah has stated. Mm-hmm.
And please remember what Dr. Bowman said, very specific disorders that most people don't have, but some people can, okay? Mm-hmm. Hemochromatosis and hemosiderosis, okay? Mm-hmm. Talk to your primary doctor about those. Right. Absolutely.
Very good. Now, we've kind of moved into the realm of if you do have it. Dr. Mensah, you mentioned that some of your patients have indicated that they've tested positive. We've got several questions from folks asking if I've tested positive. Should I anticipate that the antibodies that I build up will keep me from catching it again? Or can I pass these antibodies on to any children that I may have down the road? Those types of questions.
Those, unfortunately, these are excellent questions people are asking, by the way, excellent. Mm-hmm. We don't know yet if the antibodies that you're producing will hold over for the next time you encounter this creature. I'm saying that because we do believe there will be a next time, okay? But for right now, you're in a good place. And that's very helpful. You're developing immunity, that's wonderful. We don't know how long that immunity is going to last, okay? That's the unfortunate news. Now, it's not going to be automatically, we don't think anyway, it's going to be automatically transferred to any child that you develop later on in life. Okay, these antibodies are circulating, but what happens when you become pregnant as a female is that your immune system actually gets lowered because the developing fetus is determined to be by your body a foreign object. Now, we're all sitting back loving every stage of the development of that foreign object and seeing it move and all that stuff. But the fact is, in order for your baby to survive and grow inside of you, in order to reach maturity, your immune system has to be lowered, okay? So there is a buffer that's created there. So we can't really say that there's going to be antibody crossing through to protect the baby, okay?
Speaking of your immune system and your immunity, I've actually got several questions, some that were sent in before and some that are coming in right now, actually, asking specifically about immune health and why are some people affected much worse than others? And it gets back to what you were saying before, Dr. Mensah. obviously the immune system is playing a role here. You know, how can we treat the virus any differently than any other virus out there? And you know, are there do's and don'ts that we should be engaged in that will affect how we recover?
Wow, that is a loaded set of questions, all wrapped up in one question.
Yes, yes.
First of all, immune health is naturally key. Now, you know, I've talked about that wonderful creature we call zinc, right? And I talk about it all the time. Zinc is extremely important in immune health. But what is most of America? What is most of the world? Most of the world, this population is zinc deficient. Okay, you've heard me say this before, but here's what you haven't heard me talk about too much before. Vitamin C's role in all this. Many of you already know Dr. Linus Pauling's work. He won the Nobel Prize for his work at vitamin C and cancer. Vitamin C is tremendously important in immune function. As a matter of fact, there is not, we've understood this now just in the last month or so, there is no single mechanism that the COVID-19 virus uses to mess you over that does not involve the depletion of vitamin C. Now, most of you intuitively have gravitated towards vitamin C and picked it off the shelves. I know, because when I've tried to find supplies myself in the stores, I couldn't find them. So you're all doing the right thing, but I want you to understand why it's so critical. Why? Because vitamin C is important. It is key at every stage of immunity, every single stage. So that's a real big boy. Now, what you may not have known is that you can actually test for vitamin C levels. We're working with direct health access labs on protocols and projects to make vitamin C testing available for individuals. So you can now check your vitamin C levels, you can check your zinc levels, and you can do what's necessary to bring yourself up to speed, to give yourself, to set the stage for the best battle that you can fight, okay? Two very, very, very important creatures. So your immune health is a real important thing. Physical health in general, being mobile, that kind of thing, all very, very important. All the stuff you've heard about before in terms of exercise and eating right. Look, this creature also affects inflammation. That's how it works. It's through inflammation, like most pathological processes around. So if you're doing stuff that creates inflammation, and we talked about this with Samantha Jobert, our clinical nutritionist, if you're eating inflammatory food, you're putting yourself at higher risk. So Mr. Wells, when you asked that question earlier about somebody who thinks that they're otherwise healthy, what does that really mean? We saw a 16-year-old young man go blind because all he ate was fast food 3 times a day, and he had no vitamin A whatsoever in his system, pretty much. He went blind because of a lack of vitamin A. Usually that's reversible, but in his case it wasn't. He looked like an otherwise healthy person. So even though you think you may be healthy, by your molecular system standards, you may be vulnerable. So I think caution is the best way to go all around, okay? But I think dealing with your diet, dealing with immune health, in particular, everything that supports your immune status, especially vitamin C and zinc, with a strong reach out to melatonin, as the young people would say, these are important things you need to do right now, very much so, to help support your immune system.
So I've got a viewer here who's asking, if I do have the virus, but I'm not showing symptoms enough that require me to go to the hospital. So I'm treating my symptoms at home. I've got a temperature that's less than 103, so on and so forth. What are some other, you've talked about zinc, you've talked about vitamin C. What about some other treatments that are out there that people typically use who kind of approach medicine from a homeopathic perspective? Things like St. John's wort or echinacea. What kinds of hot drinks and sunlight, how are these things going to help us?
Okay, well, the question is, do they help, number one?
Sure.
There are a lot of good elements out there, but they have to be used in the right space, if you will. Echinacea, certainly, it's a wonderful antioxidant. That's lovely. It can help with free radicals and oxidative stress. Some folks have talked about berberine. That's wonderful, for GI status and may be helpful. Okay, St. John's wort, not really, so to speak, in the discussion per se. Okay, hot fluids, that's an odd thing to say, but guess what? This virus is likely what we call a psychrophile. So in science, we talk about thermophiles, psychrophiles, and now there's yet another category, but a thermophile is a creature, an organism that likes heat. Psychrophiles like the cold, and that's what most viruses are. This virus is no exception. We are presuming with good reason that this is a psychrophile. So if you're drinking lots of cold fluids at this point in time, what you're doing is also going to increase mucus production. You're going to increase a variety of changes that lead to acidity, and the temperature itself is an environment in which the virus will likely thrive. So it sounds odd, but hot fluids, like great-grandma and the great-grandma before her used to say, the best things for when you've got a cold or a virus. Not the cold stuff, the hot stuff. Okay.
I've got a couple of questions that have come in regarding testing. And you mentioned before the test that Mensah Medical is developing with DHA Labs specifically for vitamin C and zinc and immune health. But of course, we're hearing a whole lot about testing for the virus itself and the importance of testing for the virus. We're also hearing about antibody tests, testing to see if people have had it and have established antibodies. So we're getting questions about whether or not this is important. Which one is more important, to test for the virus itself or for the antibodies to see if you do have it? And then there's certainly questions about the efficacy of the tests. We're hearing about some false negatives, some false positives. Can you speak to those questions?
Absolutely. And I'm going to ask you to limit your questions to 12 at a time. Okay.
I'm just trying to group them together. We've got 100 questions here. We're trying to fit them all together.
First of all, every country has a different capacity for testing. And here in the US right now, what we have are really the antibody tests, and they seem to be decent and they're available. If you have the antibodies, it doesn't tell you that you necessarily have the virus. It says you've been exposed to it, okay? And so that's not the same thing as having active disease. When you're testing for the virus itself, and there's some great tests that other countries do have, including Australia, Italy, and so forth. But right now, we don't have those tests, at least as far as we know. I know anyway. We don't have those tests readily available. But if you do have the test for the virus, it tells you if you got it or not. Okay. Problem is, you brought up the false negative potential. Okay. So that too is an issue. But what's very interesting, I'm going to tell you about some test properties that we do have available. They're not necessarily being discussed with regard to the COVID-19, but looking at what doctors all over the world have been talking about. And folks, I want to share with you, this is a time where doctors are not engaged in politics. When we have a crisis, we're talking globally with each other. And that's what we've been doing. What I'm doing is sharing with you a lot of what we've been talking about. Many doctors have seen in emergency rooms around the world a variety of interesting changes with regular labs. So I'm going to share with you one very, very significant piece, and hopefully we'll get to why later. But if you have high ferritin levels, now ferritin is a storage form of iron. If you have high ferritin levels and low lymphocyte levels, you've got COVID-19. And that's because of the actual mechanism, which we're going to get into later. And if we don't get into it later today, we will get into it next week because it's severely important. But this creature displaces iron molecules from your hemoglobin. This is why a lot of this is happening relative to all the symptoms everywhere. Once that iron gets shifted from your hemoglobin, you don't have any capacity or limited capacity to really absorb or carry oxygen to your tissues. And that's where the hypoxia or the lack of oxygen comes into play. And that's why people ultimately will pass away. It's from starvation of oxygen because you don't have iron sitting there in a hemoglobin molecule, which is in your red blood cells. So let's go backwards for a minute. Red blood cells carry oxygen. How do they do that? By way of the hemoglobin that's attached to iron. And when that iron gets pushed away, it's now sitting out there free, hanging out, not much to do. But what happens now is that that iron gets moved into the storage form we call ferritin. And that's why if you check a ferritin level and you check your lymphocyte level, if the lymphocytes are low and ferritin levels are high, there's a very high likelihood you've got COVID-19 actively. And now you know how to move after that, okay? So, Mr. Wells, that was about one piece. Could you refresh me on some of the things that I haven't been addressed in that question?
Well, the questions were, you know, again, which tests are more important? Is it more important to take the antibody test or to test for the active disease itself?
The active disease is always beneficial, okay? If it's available and if it's consistent, okay? If it's got a good sensitivity and specificity, as we say, then that's probably the best way to go. We don't have that kind of testing available as of yet. So we talk about here in the US, the antibody tests, okay? They're reasonable. It's better than nothing right now. But now let's look at all the pieces. If you do the antibody test and you now do some very specific chemical testing, such as like with the ferritin as well as the lymphocyte testing, that's available anywhere, by the way, and insurance covers it. You don't need, you know, you can just get it done. If you've got those parameters, that gives you a great story that this is a much more serious situation for you than it is for other individuals, okay? You also see elevation in certain liver enzyme tests. ALTs and ASTs can also be elevated. Now, they can be elevated for a variety of reasons, so they're not necessarily specific, but that in conjunction with all the other symptoms can prove to be beneficial for you, okay?
Dr. Bowman, I've got someone here who's heard us talking about all of the great things that we're doing with our patients and our patients not getting sick. And she's asking, is this a good time to become a new patient? But more importantly, is it better to wait until we're not engaged in social distancing and until testing can be done and until folks can come see you in person?
Oh, it's a proactive scenario. It's always a proactive scenario. It's always a good time to be a patient of Mensah Medical. What we're trying to do is have your system work optimally in every single way, including your immune system response to anything. So always be proactive with that. It's a matter of supporting your immune system, supporting more than just your immune system, because it's more than what we do. It just happens to be one of the perks that comes along with it. And let me say this, to our patients that are trying to be as compliant as they can be, they probably are in the best shapes. So it's not something you want to think about doing after you've already had the problem attack you. You want to be ready when the situation happens. And so to do that, you have to be proactive with it all. So support your immune system. Eat well, support where you need to support in terms of your immune system response. And then when things come along that are going to be challenging, you're already ready. And you're not just suddenly reacting to the situation, you were ready.
And we should point out that patients, even though we're engaged in social distancing, we're still seeing patients from all around the country, correct?
Yes, we are, indeed.
And we're doing so via telephone, via video. How are we visiting with patients?
We are doing so via telephone at this point, telephone start programs, as well as phone follow-ups for our patients that are already established. And we're also giving them the up and up on what else they need to do in terms of protecting their immune system. But the biggest thing I can stress really is compliance. Stay compliant and you're pretty much well protected.
Let's talk a little bit. We've got several questions here about how the virus is actually spread. We talked before about masks and all of that, but of course we've also seen people walking around with the latex gloves and I know that in a previous webinar, Dr. Mensah, you talked a little bit about using gloves when you're shopping versus when you're at a gas station and that type of thing. So we've got questions here asking about, how long the virus can live on inanimate objects, and do animals carry COVID, those types of things.
I'm going to separate this into a couple of things. I'm going to have Dr. Bowman talk about a few things here as well. I want to talk about this animal thing, okay? I saw a video several weeks ago where everybody was sheltered in place, and they had their dog, one person had their dog deliver mail across the street to neighbors, and the neighbors, they thought it was very cute and everything. And I just kind of went like aghast, like, what are you doing, okay? Because look, when you don't know enough about a virus, you got to exercise caution. Pets are creatures, they're live individuals, they're live animals. They can carry anything, okay? We've had people come up with worms that they got from their pets, okay? That's a common and well-known thing. Of course, a virus can be carried by a pet. Now, whether or not the pet gets sick or whether or not it makes you sick directly is a different story. But the fact is, it can exist on the hair, on the skin of a pet. So Muffy comes around, you're petting Muffy, and if Muffy's been outside or exposed to other people, whatever have you, now you can infect yourself. Even though Muffy is fine, you could become sick, okay? So caution goes around with pets as well, not because they are so-called internal carrier entities, but certainly the surface of the pet, as well as even the oral cavity of the pet, contains lots of different viruses and bacteria and so forth. And they're busy everywhere, licking everything, doing who knows what, when and where. So caution has got to be there as well, okay? I'm not disrespecting anyone with the pets, but we've got to be realistic here. And this is just objective. Now, Mr. Wells, you had a few other parts of that question. I think Dr. Bowman would like to address them.
Well, I asked specifically about inanimate objects and how long the virus can live on an inanimate object. How long can it, if someone's grocery shopping, do you have to worry about the things that you're picking up off the shelves that someone else may have picked up before you?
Dr. Bowman.
That's been relaxed a little bit early on when they were discussing what to do in terms of how to protect yourself. There were a lot of videos in terms of what to do when you buy something from the store, whether it's a food item or not, wiping it down or making sure that you use something that kills viruses and bacteria. I think all of that is extremely important. I don't think we need to lighten up necessarily with any of that, but from what we're understanding, when we understand more and more about this virus, we'll know a little more details in terms of how to protect ourselves. But I don't think it's time to move away from those things. Certainly when you go to the gas station, picking up the pump, everybody else has picked it up, some with their hands, some not, but you don't know what's there. When you go to the grocery store, people do touch the food in the produce section. They touch the boxes, they touch everything. So the idea is to protect yourself. You can wear gloves. If you don't, you need to wash your hands very often. The bottom line is you don't want to inoculate yourself. So when they're saying, at least early on, it was don't touch your face. All of that had everything to do with don't inoculate yourself with something that's going to be a problem. You're giving it a place to go and grow, which is not what you want to do. And once again, coming back to this idea of viral load, the more you expose yourself to that virus, the more you inoculate yourself, you're increasing your viral load. And your immune system, whatever it is, and you don't exactly know what good shape it's in or not, the more you put in there, the more at risk you are for it to really take over and duplicate itself. It only needs you to duplicate itself so it can make a whole lot more of it and then kill off your cells. And so I think we should relax the part of trying to be as sanitary as we can possibly be, whether it's bringing something in the house, touching your face, petting your dog. And I have to mention this one, and I'm not sure what the airlines are going to do about it, but we do have animals that travel with us now a lot more, and we're all exposed to the same air quality. And so that's something else that probably needs to be addressed at some point as well, in terms of all the air that we breathe in a closed room or space, put it like that.
Now, I have to tease a little bit here with Dr. Bowman. Dr.
Okay.
Bowman, this whole COVID thing has come up. I've noticed as we travel and we journey, an increased level of frequency of your personal utility of hand sanitizers and your use of, she's very good at gas stations. There's always the gloves being utilized, but you do wash your hands and you wash food items very, very frequently. And I think one of the things you said was that even when you're using gloves, right, you may be
Yeah.
protecting your hands, but you're actually transmitting every bacteria and everything else you touch to something else that you touch with the gloves. So by the time you're done, you've got to take the gloves off and throw them away, and then still be considered to wash the items that you, groceries that you brought in and anything else you want to sanitize them still, because even though you protected yourself, other people may have been wearing gloves and then transmitted viruses, bacteria, whatever, germs to what it is that you yourself picked up. So your hands may be protected, but those items may not be. I think that's one of the things that we talked about a while ago.
I think that's correct. I really do. Bottom line is, though, if you have a barrier, so whether it's a mask or a glove, it's going to reduce the load, at least for yourself, so you're protecting yourself as well as other people as well. Mm-hmm.
So interesting that the two of you have talked a little bit about hand sanitizer and washing our hands very frequently, because we've got a couple of questions asking specifically about hand sanitizer. And it's an interesting twist because, we hear about the antibacterial soaps and how sometimes we're even killing off the good bacteria. If we're washing our hands more often, our viewers are asking, are we doing some damage? Are we maybe suppressing our body's ability to build antibodies to stuff that we would normally build antibodies to in the first place? Is there a chance that using too much hand sanitizer or too much antibacterial soap might harm us in the long run?
I don't think so. The here and now is what we're concerned about. And soap, just regular soap, kills virus. It does. This is life or death. We're not worried about 20 years from now. And by that point in time, your immune system will be fine anyway, so nothing to worry about, okay? Just very quickly, wash your hands, use the hand sanitizer. Don't worry about anything else. This is the stratification process. Right now, this is about survival. This is about survival and health. We're not worried about anything else later on, and no, that's a bit of a gross exaggeration as well. Most doctors, by the way, after going through med school and that whole process and surgery, we're washing our hands all the time, okay? And unfortunately, the worst thing that happens is really dry hands. My own students, when I was teaching, they would look at me, and for my birthday one day, they actually brought me lotion because my hands are so cracked. And that came from years and years and years of just washing my hands all the time. So dry hands is really the big issue, nothing else.
Well, you talked about, we're dealing with the here and now, Doc. I've got some questions that are asking about the future, the long-term impact. Are there any long-term effects of this virus or of other coronaviruses that we can perhaps extrapolate onto this particular one that we can anticipate down the road?
We're not sure, quite honestly, about all the ramifications of this virus. It is a creature that's got some seriously negative skills in multiple directions, okay? So, but one thing we do know is that even after people have been allowed to leave the hospital, some of them have had weeks and weeks and even months of recuperation, and some are still not recuperated from the devastation that this virus has caused, which is why we're so keen on prevention, because you don't want to get there in the first place, okay? There can be cognitive disruption. Look at the one person who lost their limbs because of thromboses and blood clots, and they got their leg cut off because it was all clotted up and it was going to become necrotic and just dead. So there are many ramifications to this. Some we know much sooner, but word is still out on the long-term issues. This thing hasn't been present with us that long yet to determine. but we've got some good prognostic indicators based upon which kind of tissues are damaged, whether it's the kidneys or whether it's the lungs and so forth. But we still don't have definitive word on that yet.
The other long-term questions go back to some things that you were discussing before, that both of you were discussing before, and that is the various mutations of this virus, the fact that it continues to mutate. Can we expect several different strains or several different mutations of this for years to come? Is this something that once we get past this wave, or once we come up with this vaccine, that we think we'll be finished with this one?
That's a hard question to answer. And again, we don't know yet. Because of the gross nature of viruses, they're highly adaptable. And incorporating different pieces of RNA and DNA, and forgive me, I'm a big Star Trek fan, so I'm going to talk about the Borg, if any of you guys out there are geeky like I was at one point, still am. They acquire technologies from other cultures and meld them to themselves. Many viruses incorporate molecular pieces that give them certain traits and characteristics, and therefore different capacities, okay, over the course of time. Viruses are just like that. In fact, that's how they work in our cells. They basically come into our cells, replace our own molecular structure, our DNA, our RNA, so that now our cells work for them by way of new instructions. So it's very difficult to say that we've seen the end of mutations. I doubt it very seriously. But now, mutations don't necessarily mean anything bad. Most viruses, when they mutate, actually decrease in their killability, so to speak, the damage that they do to the host, the individuals who are affected. So in a way, if we go by history, there's a good prognosis over the course of the long term. The problem I have is that this virus is not exactly like all the others. This is one very virulent and tricky beast that affects multiple systems. Many viruses are respiratory in origin. Many viruses may affect, one or two different systems, the nervous system and so forth. This virus affects almost any system. Almost any system you've got, whether it's renal, respiratory, neurological, immunological, you name it, it's affecting it. And we now have understanding into why we got so many of these ramifications. But I just want to say that there's so many possibilities here, it's really hard to predict what this thing is going to look like next.
And when you referred to 30 different mutations of the virus at the beginning of our broadcast, were you speaking specifically of this COVID-19 causing virus, or were you talking about coronavirus in general?
No, this one. We've looked at studies from Wuhan, China, and all over the world. And really the consensus amongst physicians, among scientists, is that this thing has indeed mutated more than 30 times already. That's what the early data was showing us.
Wow. So if someone thinks they have COVID-19, someone starts to show some of the symptoms, what are some of those symptoms? How can someone tell, or how can someone guess that I've got COVID-19 as opposed to I've just got a cold or some other strain of flu or something else?
Okay, well, most of you have heard already. We've been saturated with the idea of, you've got the fatigue, you've got the sore throat, you've got the chest tightness, you've got shortness of breath. All of these are variations of how this creature is working at what particular time with what individual. Personally, the way I look at it is, if you don't feel like yourself, if you don't feel right, you need to explore that possibility. There are so many different manifestations now that are coming out for people that I don't think it's safe to say that it's more like you need to make sure you don't have this, as opposed to wondering which symptoms are going to tell you definitively do. Again, some very simple tests can be done in terms of blood work that aren't even the antibody or the actual viral testing pieces that can give you good indication. And those are ancillary pieces you can use if you don't have ready access to the antibody test or to the viral test itself. But there are a tremendous number of things, and it progresses in stages. So stage one thing, stage two, something else, stage three. You may think your symptoms are mild in stage one, and then all of a sudden you've got shortness of breath, and you're in stage 3 or 4, or wherever it is it's hitting you. So we can't take anything for granted. We talk about normal balance. You know how your system functions in general. You know when you don't feel right. That's the time to at least make a phone call to your doctor, at least that, and then talk about them. Talk about how you're feeling with your practitioner.
No, let me add to that just a little bit. Some of the things I have heard from various sources is this profound fatigue, more tired than you ever thought that you could be. I've also heard a severe sore throat along with a fever. I've also heard people saying, well, it felt like I had a cold at first, and then suddenly it hit me like a ton of bricks and I went down very quickly. Those kind of scenarios are they're not unusual, but the level of intensity seems to be what draws people into finally being tested or seeking help from their physician.
Absolutely. One thing that you brought up, Judy, when you're talking about something, and somebody who's, Mr. Wells, you brought up the person says, I'm in normally good health, right? So an individual who seems to be in normally good health all of a sudden experiences chest tightness, or they feel short of breath. It's hard for them to breathe. Well, right now, what's likely happening is that virus is minimizing your capacity to exchange oxygen to your tissues. That's where a major threat starts to happen to the system, because that's hypoxia. And then your body starts to react, becomes inflamed. Your macrophages, your neutrophils, your white blood cells now start to release cytokines, okay? And those cytokines are what is introducing a lot of the trouble in multiple systems with inflammation and oxidative stress, and now organ damage, okay? Organ dysfunction challenge. So there's some interesting signs that Dr. Bowman mentioned. That chest tightness is what I want to mention, because quite a few individuals who are normally healthy, young, 31, 32 individuals with a wonderful wife and family or a husband, and they ended up not here anymore. And they started with symptoms just as innocuous as that. And they thought they were otherwise healthy individuals. Okay, so be cautious.
Folks, we're coming up on 5 o'clock here. We've got a few more questions, and so we will address those couple more questions that we've got here. So we'll go a little bit past our 1 hour scheduled time to get to those questions. Doctors, if you don't mind. Dr. Bowman, you mentioned just a short while ago this concept of being proactive, of making sure that your system is in good shape prior to infection, rather than waiting to get infected and then trying to fix it. I've got an interesting question here that kind of meets us in the middle there, which is, what do I do if today I interacted with someone that we just found out is positive with COVID-19? Are there things that I can do right away that maybe helps me if I've been exposed, whether I know I've caught it or not?
I mean, you certainly want to think about yourself, but you also want to think about your environment and the people that are around you. And so the general, I guess you could say, advisement would be to act like you have it. Act like you have it. You can always monitor your own symptoms to see how you are doing and the level of intensity of what you have. But for at least a couple of weeks, maybe even 3 weeks or so, you need to act like you have it, quarantine yourself like you probably should do. Certainly monitor your environment and the people in your environment, because if you don't have if you have very light symptoms, somebody else may come down with something, which means that it's a possibility they got that from you and you just had a mild case. And so it becomes a personal journey of that you have to take upon yourself, the responsibility, and simply prepare to act like you have the virus. That's all you can do. Support your immune system and everything else that we talked about earlier, which is to say that vitamin C, vitamin D, melatonin, perhaps some of the things that we told you before, zinc most certainly, and those around you would probably benefit as well from having some kind of prophylaxis. And if you think, okay, the last straw. We're at the limit. Symptoms are getting intense. It's time to go in. Do not wait. There is a thing called waiting too late, but don't do that. Go in and try to get some help, some kind of testing, perhaps even the antibody test will let you know if you had it. And then, of course, anything that you need to do from there would probably be advised by the person that's treating you. So act like you have it.
Mr. Wells, I'm going to interject for a minute here because we promised some folks that we would talk about how their biochemical individualities mix in with this whole COVID scenario. So people have asked us, for example, gosh, if you're undermethylated, does that affect your capacity to deal with COVID? Okay.
That was actually my next question.
Well, Dr. Bowman, would you like to just give a very quick, brief description or discussion on that?
Sure. Well, generally, when Mensah Medical is talking about undermethylation, we're generally talking about the person who tends to be higher in histamine. Histamine in and of itself is an inflammatory agent. And so anything that can provoke inflammation is actually going to put you at a higher risk, because any inflammation that happens causes swelling, causes exposure to cells, breaks down cell membranes, and actually gives the virus a little bit of a head jump. Okay, so undermethylation, not that it's only undermethylation that can be a problem or the higher risk factor, it's just that histamine itself being elevated is a risk factor. It really is, high histamine. There are overmethylators that tend to be more of the lower histamine variety. That does not count them out. For everyone here, we have to talk about their particular state of their immunity. Do they have, are they in nutritional deficit? Is their immune system intact? Do they have empty calories versus wonderful calories from the right foods that they eat? You know, how are they protected naturally? So there's multi reasons and multi different places that can be intact or out of tact. And whether you're over or under methylated, you are still at risk. But once again, I have to say though, for the high histamine undermethylated person, I think there may be just a higher risk because of histamine being so elevated.
On the other side of that equation, we're talking about the methyl and undermethylation. Remember, methyl molecules regulate entire systems. They activate enzymes, hormones, and neurotransmitters. You need to have as much activation balance as possible during this time. So if you are undermethylated, make sure you're taking your nutrient program. If you're overmethylated, make sure you're taking your nutrient program. We're not going to let this go without talking about Pyrrol disorder. Here is where Pyrrols run wild, right, Dr. Bowman? So
Absolutely.
you got a situation where stress, which we know increases Pyrrols, right? Take them through the algorithm, Dr. Bowman. Share with us.
So with Pyrrol disorder, it's stress intolerance is really what it amounts to. Stress in and of itself will cause your immune system to take a little bit of a dive. And so that means that you're at risk. Your immune system is dependent. Well, what is a Pyrrol disorder? Basically, a pretty profound deficiency of zinc and B6. And if zinc is low, your immune system already is at risk of taking a big hit. Zinc is absolutely necessary for your immune system to function. We mentioned vitamin C a lot, but of course, zinc is also extremely important for immune system health. So if you have Pyrrol disorder, and Pyrrol disorder is a disorder of low stress, stress intolerance, and it doesn't even matter what that stress is. So whether it's an emotional duress, whether it's a bereavement, whether you broke your leg and you're in the hospital, whether you have a cold, whatever it is, your body tends not to know the difference, except for that it is stress. And if you have a tendency to develop Pyrrol disorder, it simply means you can really spiral the drain a whole lot faster, even in terms of immune system health. So that's an issue. And you're not going to feel well because zinc is also part of what helps your neurotransmitters stay in balance. So you're not making your serotonin in amounts that are going to be beneficial. You're not making even your GABA, G-A-B-A, the neurotransmitter that helps you to actually calm yourself in a timely manner. And so not feeling well, you just tend to spiral the drain a little bit quicker.
Now, Dr. Bowman, we talked about this just a few days ago. We don't usually refer to Pyrrol disorder in this capacity. But if Pyrrols are high enough, and we're talking about the porphyrin ring, and we're talking about hemoglobin and oxidation, and we're talking about oxygen exchange, What will literally Pyrrol molecules do in that situation that can produce deficit?
In actuality, in extreme pyroluria, not only will the pyrroles try to strip you of zinc and B6, they start to attack your iron, okay?
Absolutely.
I'm thinking particularly in a lot of females who tend to be more iron deficient, those of menstrual age. And if they're extremely pyroluria, they're not only pyroluria, they are iron deficient. That is a big problem relative to COVID-19.
And Dr. Bowman, you're the queen of copper. You're the one who did the research with Dr. Walsh on this. One of the world's, actually probably the world's leading expert on female health and copper toxicity. Talk to us about what copper does now. If you're a high copper person, and look, we're talking about this individually, but people are high copper, pyroluria, undermethylated all at the same time. What does high copper do to this situation if you're a high copper person?
Well, first I have to back up and say that there's this relationship between copper and zinc. They are best utilized when they're in a 1-to-1 ratio. However, when one of them goes up, particularly copper in females, zinc levels tend to plummet. That is a problem. And I usually tell my story about the snowball rolling down the hill. Well, it generally goes like this. High copper females tend to be estrogen dominant females. For whatever reason that there is, and I can't exactly explain, they do not process or get rid of copper fast enough. As if there's a hole in the bucket, but the hole in the bucket is so small you can still overfill it. When that happens, zinc levels are depressed. If zinc levels are depressed, not only are neurotransmitters thrown off, but your immune system is also thrown off. And so that's really where that comes into play. And it comes into play a little bit more in females because of estrogen dominance and this tendency of not being able to process or excrete, I should say, copper in amounts that are reasonable enough to bring it back down to the normal levels. And that's a real big issue. The copper by itself, though it's important to the immune system, when there's too much of it, we run into difficulties. It actually suppresses it as opposed to support it, okay? Copper is necessary for iron absorption, but there is a critical amount for which if you go over that, it tends to tear down the system.
So once again, we're back to the whole idea of a key piece being here, iron. And folks, there are also all the ideas around what copper does with regard to neurotransmitters. So you end up with a likely higher fight or flight situation because of higher dosages or higher amounts of norepinephrine in the system. And remember, norepinephrine is a fight or flight mechanism, which causes stress in the system, which now causes cortisol levels to rise, which now starts an immune reaction that gets worse and worse if you've got the COVID. So there's tremendous interlacing capacities here between biochemical imbalances and the situation with the COVID in terms of preparedness and the human condition to support that, okay? So that's a very, very big piece. We don't have time to go through all that. Dr. Bowman, thank you for explaining that to us. Mr. Wells, we're gonna go to a couple more questions and then we have some other thoughts to share.
Okay, well, actually, the last couple of questions, you answered several of the questions that were still on my list here, but the last couple of questions that are showing up are asking about the fact that several states, that several localities are beginning to open things up, they're beginning to relax some of the social distancing protocols and such. And so we've got people who are asking questions about how concerned they should be about those relaxed regulations, those relaxed suggestions. One in particular is asking, should I avoid going to a wedding that's scheduled for June or July, even though the restrictions in the place where that wedding is going to be held are being relaxed?
Okay, that's a very good question. I really want to share with folks, this is a very serious matter. There's a difference between science and economics and politics, okay? Let's talk about the science right now. Most of America realizes or is aware of the fact that we don't have easy access to testing. We don't have treatment. We don't have a cure. We still have a virus, okay? We should be cautious no matter what the environment is around us. We should still be cautious. This is how you protect yourselves. This is what we're talking about today. We have to protect ourselves, because just because we're relaxing certain entities, it's because we want to try to get the economy moving again. Okay? It doesn't mean that we've cured anything. It doesn't mean that we're on a downward slope here. We haven't done the stuff that other countries have done to put ourselves in a downward slope. Look, Australia, as of last week, reported in one day there were 0 new cases of COVID. That's Australia. Other countries have reported similar. Many other countries have not. We're not the only ones. But you've got to be aware, and you've got to protect yourself right now. Okay? It's a hard place to be in. The way we're structured in this society means that we've got to do some things that may not necessarily be comfortable for folks. But what we can do, and I'm not going to get into all that politics stuff, but what we can do is to protect ourselves in every way, shape, or form we know how. Okay? Depending on how things are going. Once again, if this is a cyclophilic, the virility of this virus in the summer months. We expect a downward scaling of this virus, but my concern is what happens in winter. Because the vast majority of us are very concerned that we're going to see a spike. And that spike may be 2 to 3 times what our initial situation was with this virus. So don't get too relaxed out there. That's really number one. Do not get protective. Don't worry about what other people are doing. Do what you hear from scientists and doctors, okay, is the right thing to do. Judy?
I was going to say, you have to think about, who are you? Who am I? Do I have an immune system compromised? Am I hypertensive? Am I diabetic? Is there something else going on with me that raises my risk factor? Am I 7 years old? Or am I 60 years old? I mean, there's things that happen along the life's line that may put you at risk or not. So you're gonna have to work with a personal risk-benefit ratio. And if you're willing to take it, then you're willing to take the consequences. That's just how that goes. But it's gonna be a personal decision.
Well, that's pretty much all the questions that we have. We've tried to combine a lot of questions, and so folks, if I didn't read your question verbatim, hopefully you can find the answers in all of the many things that have been discussed here. But we've had several questions come in, and thank you so much for so many outstanding questions.
There's one question that I do want to address that we got earlier, and that involves a new drug therapy that's come out that is supposed to work really against the ACE2 receptor. And that is now in process. It's the ECCG or something like that, I can't remember, but being done out in California. Now, that has got good potential, but it is not yet fully tested. They've got to still find a partner, a pharmaceutical partner, to produce this thing. There's still other testing. So we're not looking at a cure tomorrow for this. So that's something that we also have to be cautious about. It's a good indicator, it's a good hope, but we're not there yet. Now, I do want to conclude with something very interesting, and I probably should have started with this. We need to look at this virus differently, and I'm talking to all of our doctor colleagues, and I'm talking to patients as well. This is not a respiratory virus, and I know what you're thinking. Dr. Mensah, you are out of your mind. Of course it's a respiratory virus. People are on ventilators. No. This is a multisystemic, multifocal virus that has a particular way of working. And the way it works is that it affects endothelial cells, which are layers in not just vasculature, but tissue. It affects red blood cells. And then there's a domino effect that starts to happen after that. We know this because we see these symptoms in the blood clotting cascade. This is just as much a cardiovascular or a vascular disorder as it is respiratory. Think about it. All you doctors that are out there, colleagues, friends, everything that shows up is usually the end result of something going wrong with the clotting cascade, which now sets inflammation into order. The opposite way around, inflammation setting vasculature and clotting issues happen. So now you get blood clots to the brain, you get blood clots to the legs, you get skin discolorations. The reason why people go through pulmonary challenges is not just the ARDS, but also blood clots to the lungs. then inflammation takes over. And as Dr. Bowman points out, what is called a left shift occurs when you get hypoxia or lack of oxygen. That left shift now produces coagulopathies. In other words, a heightened capacity for blood clots. There have been doctors who said in the ER that they couldn't stop a patient's bleeding and clotting fast enough because they didn't expect it to happen. We've contacted different governmental resources to share with them that this is not a respiratory issue. This is a vascular issue with respiratory manifestations, kidney manifestations, renal that is, gastrointestinal manifestations, neurological manifestations, encephalitis can be seen as a result of it. There is not one singular perspective here that says this is a definitively blah, blah, blah virus. This is a virus that is so lethal because it has so many different manifestations. But you know what is really keen here is that when you look at this from a biochemical level, when you look at this from an orthomolecular level, you're seeing what the molecules in the system are doing. And these molecules are very well geared towards inflammation, towards oxidative stress, and absolutely positively iron and the removal of iron from the heme structure is pivotal. Folks, you're not all doctors, so let me just share with you. If you don't have iron, you can't carry oxygen. People are on ventilators, and why do many people die on ventilators? Well, because ventilators are machines that are designed to push the movement of air and through the system so that you can get oxygen exchange in the lungs. If you have no iron, it doesn't matter because you don't have hemoglobin on board that can attach to oxygen and release carbon dioxide. So now you become acidotic, you become acidic. That leads into a cycle of oxidative stress and inflammation. Those cytokines you're talking about, guess what? Those cytokines are released by macrophage cells, white blood cells, PMNs or polymorphonucleocytes. Each of those now goes wild, so to speak, releasing all these inflammatory elements that now move throughout the system and lead to destruction. This is a multi-systemic phenomenon. What is very key for many people who are actually in the ER or many people who are actually ending up on a ventilator, they likely need to be on some type of blood thinner. Now, let's get back to this full cycle. We talked about vitamin C and zinc being so important from the very beginning. One of the things that vitamin C does is that it loosens up the blood, so you don't get as much clotting, okay? Vitamin C helps in the whole hemoglobin iron binding oxygenation thing. So now you get the capacity to exchange that oxygen when you're on a ventilator, if you get to that point, okay? Zinc is also very key in immune function, but what I wanted to share with you is keep this in mind. If we start taking a different look at what this creature is doing, it's telling us we're not just part of the respiratory system. It's showing us with all its different manifestations. We've got to change our thinking process and say, hey, what is this thing really doing? What's the commonality here? And what you'll see is the commonality really has to do with our red blood cells and the damage that's being done. That's why hydroxychloroquine and chloroquine are touted to be so beneficial in theory against this virus, because the malaria creature attacks red blood cell structure and removes iron from the system. So you can either call this wild coincidence that a drug that has to do with malaria may be beneficial with COVID, or you can look at the molecular science, orthomolecular science, which is telling us exactly how these two separate mechanisms overlap. And that's what I want you to remember. This is a very different creature. It is not a respiratory creature. It is really a vascular creature with respiratory, renal, and a variety of other ramifications. All right, that's enough of my pontificating, right?
And Dr. Mensah, I was going to say while you were ranting there for a second, we had one more question.
Frustrated.
We had one more question come in, and I was going to say to folks, we're going to come back again next week and continue this conversation a little bit, because we've had so many good questions, and I would anticipate that many of you will have good questions that will come up now that you've had a chance to hear what Dr. Mensah and Dr. Bowman have had to say. Certainly as people view the video replay of this, they may have further questions. And so I want to encourage everyone to certainly send in your questions again ahead of time, and also to be with us again next week so that we can answer them. But we got one question in that was very specific to what you were just talking about in terms of people being in the hospital and on ventilators. And I want to make sure that we touch on that today, because I think it's an important one. And that is, if someone goes to the hospital, is there anything that they should be questioning in terms of their treatment? Should they be refusing to go on ventilators if they think that there's something going on biochemically that may not be addressed by that? Or should they, are there treatments that we should be cautious about accepting as they are presented by our hospital physicians, by our primary physicians?
That's a great question. But here, folks, listen, trust your doctors in the ER. These are highly skilled, highly capable folks. And I know what they go through, because that was my previous calling before I decided to go into family practice. Yes, Dr. Bowman, I was just a gung-ho ER guy, did everything from pediatrics ER to surgery to ER to the whole bit here. Trust those doctors. They're doing everything they know. Our goal is to try to help add to that. So one of the things that we talked about was, really, if we can get started on an IV drip of vitamin C, okay, for people who are certainly in the hospital, those who enter the ER, IV vitamin C, literally at 12 grams every 12 hours, can be hugely beneficial. I'm not saying in substitution of anything the doctors are doing. I'm saying in addition to everything that's happening in the ER. Hugely beneficial, as we've seen it with the original SARS virus, and as we've seen even in trials throughout the country. One of the problems is that many of the hospitals in the United States that are doing these trials of vitamin C are using way too low of a dosage. They're using about 1.5 milligrams 3 times a day, which is roughly 4,500 milligrams of vitamin C. I already told you what the preventative dosage is here. We're using 6,000 to prevent. That's not going to be hospital treatment. Docs that are out there, please increase that dosage of IV vitamin C that you're using in the hospital. If they want to put you on a ventilator because you need it, but what we're saying is, don't refuse any of that. Okay, please don't. These people are going to be saving your lives. They know what they're doing. Okay, there's nothing really to question that they're going to do overall. The question might be is, what else can we do? And that's where we want to add these pieces of knowledge. Everything from agents that will help stop blood clotting once liver function tests are done, knowing how to treat those things. It's key. And I do want to say something about children. I have discovered through this process how amazing the Creator is with regard to life here on this planet. Children are so protected, very interestingly, because they have extremely high levels of melatonin. Up until a certain age, our babies, our toddlers, our young children, they've got 10 times as much melatonin as an adult in their 20s and 30s and 40s has. As a matter of fact, the older we get, the decreasing curve for melatonin gets even lower and lower and lower. What's so significant about melatonin? It's for sleep, right? No, it's not just for sleep. Melatonin hits a very, very critical key element that's called an inflammasome and stops inflammation in a very powerful sort of way. So that's why at the beginning of our conversation, I said our top 3 elements are actually vitamin C, zinc, and melatonin to take to help protect yourself, okay? Especially in adults. Children, for the most part, they're doing pretty well, okay? Our babies, so well protected. That's nature's gift, and I love it. But I've learned a lot from that discussion, okay? So, in terms of what we're doing in the ER, in terms of what you should be avoiding, no, by all means. Someone asked about hyperbaric chamber therapy versus mechanical ventilation. Folks, they're not even close. If you need that kind of oxygen, you need to be on a ventilator. Okay, hyperbaric chambers are just large tubes where they push in oxygen at a high rate. The mechanical ventilator can be controlled precisely in terms of pressures. They can be adjusted externally by a professional. Dr. Bowman, you were the queen of the ICU for a while. And when we talk about ventilation systems, you know they have to be adjusted, all right? And they have to be done in a fashion that allows, hour by hour, half hour by hour, half hour monitoring by professionals. So please, if you end up in the hospital, do what they say. By all means, they're there to save your lives.
One more thing I have to say though, when you take your melatonin, whether you take it for sleep or not, or low dose melatonin, you might want to take it towards bedtime. It'll make you groggy during the day.
Absolutely. That is the recommendation. Everything else can be any given point in time of the day, but melatonin is at night. It is at night. Okay.
Absolutely.
There, Mr. Wells, I think I've gotten most of that out of my system, right?
Well, that's good. So you can store up for next week, because I'm sure we're going to have several more good questions that are going to come in over the course of the week, and when you join us again live next week. So thank you, Dr. Mensah, Dr. Bowman, for all that you've shared with us today. And thanks to all of our attendees who have sent us some great questions and listened in today. A reminder that later on this evening, we will post a video replay of this webinar to the Mensah Medical YouTube channel, and a link to that video on the Mensah Medical Facebook page. So if you want to go back and revisit any of the advice that Dr. Mensah and Dr. Bowman have shared today, if you want to encourage your friends and family to take a look, to take a listen, you can find the video replay there. So please do so. Again, next week, Dr. Mensah will be back with us to answer any additional questions that may come out of this discussion. And then we've got other special guests lined up for you in the weeks to come to talk more about some of the cultural issues that we talked about last week, some of the nutrition and psychology and anxiety and stress issues that we've talked about in weeks past as well. So please continue to join us. Dr. Mensah, you had something else you wanted to add?
Yes, I want to, first of all, I really want to thank all of our colleagues globally, I do mean globally, who have been sharing their information and all the conversations that we've had and all the research that's being done and sharing those research pieces. We are all working as a global team here. Do not be deceived. We are working very hard, very actively. It doesn't matter what position in medicine you held. Right now, we're all basically specialists in trying to keep this thing from getting worse. So my Australian colleagues, my Nigerian colleagues, my US colleagues, my Austrian colleagues, and German, all of you doctors, thank you so much for sharing. And our independent researchers, Doris, thank you so much. And we'll be in touch and we'll be talking again.
Very good. Thank you again for joining us, everyone. And we will see you next week. Bye-bye now.